Just now, a woman was admitted to the hospital for surgery due to colon cancer. When George was taking a blood sample from her, he found that his hands were shaking uncontrollably. So he asked the nurse to take the blood sample to the laboratory, and he himself lay down in the observation room. But not long after, the nurse came to the observation room because she didn't feel well. Even the laboratory technician came. George immediately realized there was something wrong with the patient's blood.
The patient's blood is toxic. It's making us sick. Has the chief started Marina's operation?
They were wheeling her up as I came down.
What's the extension for OR1?
However, no one answered the phone. All the doctors in the operating room had fainted. Fortunately, George discovered it in time. The fainted doctors didn't have any serious problems. After an investigation, they found herbal supplements in the patient's bag. It might be that it combined with chemicals and turned the patient's blood into some kind of nerve toxin.
Okay, all our people are being treated. Now what do we do about her?
The doctors were about to put on sealed protective suits, but the air circulation time inside the protective suit was only 30 minutes. At this time, the patient had woken up. The doctor rushed into the operating room immediately and injected the patient with an anesthetic. Then he managed to walk out of the operating room with great effort. The chief surgeon who had put on the protective suit also rushed in quickly to continue the bowel resection surgery. However, 30 minutes was not enough to complete the surgery. The two chief surgeons soon fainted too. Next, they could only work in shifts. While holding their breath, they bandaged the patient's abdominal incision. The first doctor took a deep breath and rushed into the operating room.
If you feel faint, get out. Come on, Yang, hurry.
Soon she bandaged the wound and rushed out of the operating room. And the second doctor was going to cover the patient's abdomen with plastic film, but she took a deep breath and rushed into the operating room. She could only cover half of the abdominal cavity before she couldn't hold her breath and rushed out. It was the third doctor's turn. In order to get as close to a vacuum seal as possible, she tightly wrapped the patient's abdomen with plastic film. When the plastic film inflated, the patient was sent for dialysis to remove the toxin from the blood.